All right, here's the next question. Once again, we have a diastolic and systolic blood pressure. And then let's talk about these drugs. Phenoxybenzamine, once again, alpha blocker. Methylmolamine, ganglion blocker. Propranolol, beta blocker. Let's look at the drugs. Epinephrine, alpha-1, beta-1, beta-2, norepinephrine, alpha-1, beta-1, phenylephrine, alpha-1, isoproterenol, beta-1, beta-2, tyramine. This is an direct norepinephrine, so it's for our sake beta-1, beta-2. So based on this question, it looks like that norepinephrine and tyramine are both going to be incorrect answers because they essentially do the same like thing. The next thing that we want to look at is our little chart over here. It's like alpha-1. Alpha-1 increases blood pressure. Beta-1 only increases systolic. Beta-2, they will decrease both systolic and diastolic blood pressure. So in the control, we notice that systolic and diastolic increase. My first impression is that alpha-1 is a really good answer, because if it were only alpha-1, they would both increase to an equal rate. However, let's take a look. Why not something like norepinephrine? Why can't it be norepinephrine? Because let's just say this is alpha-1, and if you increase only alpha-1, it would increase the blood pressure like that. If it were something like epinephrine, you would have a beta-2 effect. This would pull the diastolic down, and then the beta-1 effect would pull the beta-1 up. That doesn't look like my control, so I definitely don't think that epinephrine would be right. And then finally, let's take a look at isoproterenol. Isoproterenol would look like this. So like if you have isoproterenol, it's beta-1 and beta-2. So if beta-1 is, okay, so let's take a look at beta-2 first. Beta-2 would decrease it both at equal amount, and then the beta-1 would raise the systolic up. So it would look more like something like this, systolic and diastolic. So it can't be isoproterenol either. So the only answer that could possibly be is going to be phenylephrine, which is alpha-1, which is going to only increase the alpha-1. Now let's take a look at phenoxybenzamine. Phenoxybenzamine would block alpha-1, and then you have no effect. That works out. Methylmolamine is a ganglion blocker. The only thing that you're concerned about in this case would be a reflex, and in this one it doesn't really show a reflex. I would expect a little bit of a decrease in heart rate, so it's not really perfect. And then finally, propranolol. Propranolol is a beta blocker. Now, if you're adding an alpha agonist into your solution and then using a beta blocker, obviously the beta blocker is not going to do anything. So if you compare the control and the beta blocker pretreatment, nothing happened. So once again, the best answer seems to look like phenylephrine.